Well, again, hello everyone, and thank you for joining us today. Thanks to those who are joining now. We appreciate you being here, and I want to just take a moment to ensure that everyone in the audience is ready and comfortable with the technical aspects of the webinar. As you will see, closed captioning is enabled for today's webinar. We also have American Sign Language capabilities enabled in this meeting. You can activate it by clicking the interpretation icon on your Zoom navigation bar. If you do need tech support during today's webinar, please do send a chat message to the hosts and we'll address it for you. Lastly, if you have questions during the presentation, please do enter them into the Q&A area, and those questions will be sent to the presenters and moderators directly, and we'll do the best we can to answer as many of those as we can during and after the webinar. All right, I want to note also that the views expressed in written conference materials or publications and by speakers and moderators do not necessarily reflect the official policies of the U.S. Department of Health and Human Services and Substance Abuse and Mental Health Services Administration, nor does the mention of trade names, commercial practices, or organizations imply endorsements by the U.S. government. Okay, so my name is Mary Woodruff. I'm a member of our webinar host team within SAMHSA's 90-day Crisis Systems Response TTAC. SAMHSA has selected Altarum to provide training and technical assistance support to states, territories, tribal organizations, and community partners across the 90-day Suicide and Crisis Lifeline and Crisis Continuum of Care. Along with our partners, W2 Consulting Corporation and Change Matrix LLC, who have extensive experience with crisis services and technical assistance, the CSR-TTAC was formed to support the continued growth of the 90-day Lifeline and build a more robust crisis care system. The goal of the Crisis Systems Response TTAC is to support crisis care system that's integrated, sustainable, and aligned with evidence-based and evidence-informed practices. If you would like to learn more about the Crisis Systems Response TTAC, you can visit our website, which is in the chat. There you can request technical assistance, explore the resource library, view recordings and files from past events, and also see upcoming events. And if you're not already on the CSR-TTAC newsletter list, you can sign up there. Okay, now we are ready to kick things off with a poll. We see a lot of folks across the country here with us today and want to know a little more about your familiarity with the guidelines. So the question is, how familiar are you with SAMHSA's 2025 national guidelines and model definitions coming into today? So we encourage you to enter your answer into the poll as it comes up on the screen. We've got a few options: brand new, some familiarity, familiar, having a working knowledge, and a deep familiarity. So we'll give folks a couple of minutes to respond. Okay, I think we can probably close the poll and see what responses we have. All right, looks like we've got a good amount of folks who have some familiarity, so are not necessarily brand new, but have are familiar with them and have read them, and also a good amount of folks who have working knowledge and have deep familiarity. So it sounds like we are all across the spectrum. All right. So now I'd like to introduce some of my team behind the scenes on this work stream. We've got myself, Bree Carr, Samitra Polkato, Stephanie Liu, Jennifer Sedavi, and Milan Ellison. We'd also like to introduce our SAMHSA team. We've got Jill Mays, Division Director of Crisis System Transformation in the 90-day and Behavioral Health Crisis Coordinating Office, who we are lucky enough to have as our featured speaker today. Other members of our SAMHSA team are Tiffany Russell, Chief of Crisis and Justice Initiatives, and Dr. Laura House, External Engagement and Capacity Building Lead for the 988 office. We're very grateful for their partnership. And on our next slide, we have our agenda for today's webinar. So first, we will review our learning objectives. After that, I'll hand off to Jill for our presentation. We'll have some time for Q&A toward the end, and then we will shift into our office hours for the last 30 minutes at 2 p.m. Eastern. And here are our learning objectives. So by the end of this webinar, we hope that you'll be able to describe the purpose of the SAMHSA 2025 National Guidelines and Model Definitions and how the two documents work together to support crisis systems development. We hope that you'll be able to apply each of SAMHSA's 5 self-assessment questions to reflect on where your crisis system stands currently across the 3 essential elements and the infrastructure components needed to design, implement, and sustain a coordinated system. And lastly, we hope that you'll be able to identify the most urgent gap in your crisis system across 3 essential elements and the infrastructure components and connect them to upcoming CSR-TTAC resources and support. We really hope that today we will get some good feedback from all of you who are out in the field doing the real important work and be able to build out the rest of our year's crisis system deliverables and information for folks. And yes, Casey, the PowerPoint will be shared after the presentation as well as the recording. It'll end up on the Crisis Services TTAC website, probably in about a week, I think. All right, now I think we're ready to shift over to Jill Mays, Division Director of Crisis System Transformation in the 988 and Behavioral Health Crisis Coordinating Office at SAMHSA, as our speaker today. Over to you, Jill.
Thank you, Mary. Good afternoon, everyone, and welcome. Thank you for taking time out of your, I know, busy schedules to join us today. For those of you who I haven't had the opportunity to meet, either at a site visit or a conference or a policy academy, I'm Jill Mays, as Mary said, Division Director for Crisis System Transformation and Communications within SAMHSA's 988 and BHCCO office. So today we're going to spend about 30 minutes looking at SAMHSA's 2025 national guidelines for a behavioral health coordinated system of crisis care. Say that 5 times fast. And the companion model definitions for behavioral health emergency crisis and crisis related services publications. Together, these documents represent the next evolution of behavioral health crisis care following the implementation of the 988 Suicide and Crisis Hotline. But before we begin, as we go through the presentation, you're going to notice some Lego images throughout, and they were inspired by my goddaughter, Navy Lieutenant Commander Brianna Britt, who also happens to be a Lego influencer. I had a 60th birthday, and she gifted me, if you all can see it, this wonderful Lego build set. And today they make incredible Lego build sets of all types of things. But watching her, I saw a heart. Somebody else loves Legos here. Lots of Lego lovers. But watching her create all of these incredible builds reminded me that remarkable crisis systems don't begin fully assembled. They begin with these bags of pieces. All of those individual pieces that are meant to be intentionally connected. So that image of the Lego builds, it stayed with me because communities across the country already have many of the right pieces. The question the national guidelines ask is, how do we connect those pieces into a coordinated system so that from the perspective of the person seeking help, it feels seamless? And that's what our presentation and our conversation is going to be about today. So let's begin with why these updated guidelines were needed. Next slide. Thank you. So the original national guidelines were published back in 2020 before the nationwide launch of 988. And since then, we've learned an incredible amount. Communities have expanded services, built partnerships, tested new approaches. We see and hear about you all doing all of these things. And we've gained some real world experience on implementing crisis systems. So the 2025 documents build on that experience. Every community starts from a different place. Some communities are just beginning to understand what a coordinated behavioral health crisis system looks like. Others have been investing in crisis services for years and are now working on improving coordination. They're working on financing. They're working on building up and retaining and sustaining their workforce. And they're working on quality improvement. And there isn't a single starting point. There also isn't a single finish line. And the title of today's presentation is very intentional around that idea. Assessing and advancing your crisis system isn't about checking off boxes. It's about understanding where your community is today and identifying the next practical step toward a more coordinated system. So throughout today's discussion, I'd encourage you to think less about whether your community has a particular service or whether it has enough of a particular service, to focus on more so how those services work together. Because all communities have some services, but we want to look at how they're working together. Do people move smoothly from one level of care to another? Are your partners communicating across the continuum? Is there follow-up care after the immediate crisis is resolved? Those are the kinds of questions that distinguish just a collection of services from a real coordinated system. And if I can come back to that Lego analogy for just a moment, having a box full of the brick doesn't automatically produce, you all can see it, this beautiful bouquet of Lego roses. You need a design, you need structure, you need connections. Before behavioral health crisis systems behavioral health crisis systems work exactly the same way. Today's presentation is really about how to take those individual pieces and connect them and build something that's really meaningful for those in the community who we're committed to serve. Next slide. So this slide shows how SAMHSA's behavioral health crisis guidance fits together. On the left, you'll see the two foundational documents, the ones we're going to focus on today, and these are already available to you. The national guidelines describes the vision and the framework, and the model definitions describe those individual pieces, the individual services that make up that system and establish consistent terminology across the field. And then on the right, these are the implementation resources. The Crisis Workforce Model Standards document has already been released, and then additional guidance on mobile crisis services and crisis stabilization services. The mobile crisis is hot on the presses, will be released very soon, and crisis stabilization guidance will follow soon after that. And together, all of these resources are intended to support communities at every stage of system development, from establishing those foundational services to then strengthening the coordination between the services and ultimately long-term sustainability. So let's take a closer look at the two foundational documents. Next slide. These two publications are designed to complement one another. So think of the national guidelines as the roadmap. It describes the vision, the guiding principles, and the infrastructure that's needed to build that coordinated behavioral health crisis system. And then the model definitions provide a very important common language for us all to use. This document defines the services that make up the system from 988 all to mobile crisis to crisis stabilization, and then they establish consistent expectations for those services because consistency matters. When communities, providers, policymakers, payers, and partners are using the same terminology, then it becomes much easier to plan, finance, evaluate, and improve crisis services together. So in short, the guidelines help us understand how the system should function, while the model definitions help us understand the components that make up the system. So what are these documents ultimately trying to accomplish? And we'll look at that, but I want you to know that both of those documents are right now available to you through the SAMHSA store. And someone from the TTAC, I'm hoping, will put those links in the chat for you. Next slide. So let's look at the overall purpose and goals of the 2025 crisis guidance. At the highest level, these documents have two goals. The first, to improve the quality of behavioral health crisis care. The second is to save lives, help save lives by helping to ensure that anyone experiencing a behavioral health crisis can receive the right help at the right time wherever they are. So back to our Lego analogy from the beginning, building a coordinated crisis system isn't about just collecting all of the bricks. It's about making sure the pieces are connected in a way that actually works for the people who rely on them. When the pieces fit together, people experience coordinated care instead of disconnected programs. And isn't that a beautiful vision? When things come together, it's something beautiful to see. And that's the vision that these documents are intended to support. So, what does that coordinated system actually look like? Next slide. So, everything we've discussed so far comes together on this slide. SAMHSA's vision is a comprehensive, integrated, trauma-informed behavioral health coordinated system of crisis care that includes someone to contact, someone to respond, and a safe place for help for anyone, anywhere, at any time. The first essential element, someone to contact. For many, that's 988, but it also includes other behavioral health crisis hotlines, peer operated warm lines, and emotional support lines. The important point is that people have an easy place to begin when they need help. The next element, someone to respond. Depending on the situation, that response may come from a behavioral health practitioner only mobile crisis team, a co-responder team, a mobile response and stabilization service, MRSS for youth and families, or a community outreach team. Think about an individual who is unhoused. Often a community outreach team are the first connection they may have to the crisis system of care. The goal here is to bring the right response to the person rather than expecting the person to navigate a complicated system during the crisis. The third element, a safe place for help. Sometimes people do need more than just a phone conversation or a text or an in-person response in their community. They need a therapeutic setting where they can receive assessment, stabilization, treatment, and support. So I'd like to highlight a concept that runs throughout the national guidelines, and that's the concept of no wrong door, which hopefully many of you are familiar with. People shouldn't have to understand how we've organized our crisis system in order to receive help. They shouldn't have to decide whether they need 988 mobile crisis or stabilization services. They simply need to know they need help. Our job is to make sure that wherever they enter the system, they're connected to the right level of care at the right time. That's also why I want to draw your attention to the statement at the bottom of the slide. Follow up and linkage are critical across all of the pillars. Crisis doesn't end when the immediate crisis is over. Follow up, warm handoffs, and connection to ongoing services, that's what transforms individual encounters into a coordinated system of care. And that brings me again back to the Lego metaphor. The three essential elements are the building blocks, but it's the connections between those blocks, no wrong door, follow up, and linkage that create a system that people can depend on. So now that we've talked about the vision, let's talk about why that coordinated system matters. Next slide. So I think the answer begins with one simple observation. People don't really experience our organizational charts. They experience our system. When someone is experiencing a behavioral health crisis, they aren't thinking about which agency operates 988, who funds mobile crisis, where are the crisis stabilization facilities located, who's on staff there, what credentials do they have. They're not thinking about all of that. They have one question: can someone help me? From their perspective, there should be no wrong door. Whether they enter through 988, through mobile crisis, an emergency department, a community provider, a school, or another trusted partner, they shouldn't have to navigate the system. The system should navigate for them. That's what coordination means. It's making sure people receive that right response at the right time in the right setting and that they don't fall through the cracks because services aren't connected. You can have a great 988 center. You can have an exceptional mobile crisis team. You can have an excellent stabilization facility in your community. But if those services don't talk to one another, if warm handoffs don't happen, or if people have to tell their story over and over again, then they haven't experienced a coordinated system. They've experienced disconnected encounters. And the national guidelines challenge us to move beyond measuring the success of those individual pieces and to begin asking how well the entire system works together for the people it serves. So, with that in mind, let's shift the focus to your own community. Next slide. One of the things I appreciate the most about the national guidelines, and that definitely for me was a labor of love, some years of work pulling that together, but it's that the document recognizes that every community starts from a different place. We made no assumptions. So these five reflection questions, and they can be found in the intro part of the national guidelines, they're designed to help communities honestly assess where they are today before deciding where they want to go next. So as you look at these questions, I'd encourage you not to think only about what's missing. Think about what's working. What strengths have you built in your community? What partnerships have you developed? Where are the opportunities to strengthen coordination? And who may still be experiencing barriers to accessing care? And I don't expect you to answer these questions right now. Instead, I'd like you to just keep them in mind as we move through the next few slides, and then we'll come back to them through a series of interactive polls and a fun Mentimeter, fun and thoughtful Mentimeter exercise that I think will help us all as we plan to move forward. My hope is that you'll be looking at these questions through a different lens by the time we return to them. So let's begin by looking at the overarching principles that should guide every coordinated behavioral health crisis system. Next slide, please. So if the vision told us where we're going, these principles tell us how we should build the system. Rather than reading all 11 principles, because I know you all see the slide and you can read, but I'm going to group them into a couple of key ideas. First, a crisis system should be comprehensive, integrated, coordinated, and developed using a systems-based approach. Every word that I used in that sentence was about connecting. Because coordination doesn't happen by accident. It requires strong partnerships, shared leadership, accountability, and intentionality. You have to want your system to be coordinated. You have to work towards your system being coordinated if it's going to happen. So that's why the national guidelines introduce this concept of an accountable entity. In my house, we often find ourselves with a sink full of dirty dishes, and I'm asking whose turn was it to do the dishes tonight, and if we don't have a schedule, it doesn't happen because everybody's thinking the other person was doing it. So I took it upon myself to be the accountable entity around dishwashing at our house, made a schedule, put it on the refrigerator. Everybody knows what the plan is and what their role is in the plan when their role comes into play. We don't have that problem as much as we used to. So this is what the national guidelines accountable entity concept is about. An organization who will be responsible for looking across the entire crisis system, who will be accountable for bringing the partners together, accountable for coordinating planning around the system, monitoring performance, and driving continuous improvement. Uh, the accountable entity doesn't provide every service. It's just the organization or institution, or whether it's your state government, whatever that accountable entity is, everybody recognizes it and it is responsible for helping to ensure the services function as one coordinated system. And I hope that that message is ringing true. If there's not a responsible person, does it really happen? And who do you go to? Where does the buck stop? And when you really come to evaluating and thinking, have we done what we intended to do? And it's hard to think about doing that if everybody is kind of trying to lead the process. Everybody needs to be a part of the process, but there needs to be someone accountable for seeing that the system moves forward. Second, the system has to be person-centered and family-focused, providing the right level of care at the right time in the context of whether it's an individual, whether it's a family, whether it's a young person, whether it's an older person, whether it's a person who lives in a metro area, whether it's a person who lives in a rural area. We all have unique needs. We're all individual people. So the system has to recognize that and be person centered. Third, has to be safe. It has to be accessible. You can build a great system, but if people can't access it, what did you really do? It has to be developmentally appropriate and it has to be responsive to all populations, all while recognizing that every person's needs and circumstances are different. So access for one community might not look the same as access for another community. So you have to keep all of these things in mind as you're building your system. Fourth, crisis care has to be trauma informed. It has to be resiliency and recovery oriented. We're not just looking at kind of resolving each individual crisis, but not helping the person move toward wellness, toward building resiliency, but before getting into recovery. We don't want, our hope is that, people definitely use 988, but our hope is at some point down the line, they will have built up some resiliency skills or gotten connected to services in their community so they have fewer crises or they're more connected and have more resources. So it has to be trauma informed, but we're looking toward an end of wellness, more well-being for the individuals that we serve. We really want to, as the saying goes, it'd be great if we could put ourselves out of business and that people really grab onto that concept of wellness and understanding that seeking services sooner rather than later is something that we could all benefit from. And finally, the guidelines emphasize continuity, quality, and holistic care. Crisis care doesn't end when the immediate emergency ends. We have to have follow up, linkage, continuous quality improvement, looking at what works, looking at what doesn't work, enhancing what works, changing what doesn't work, and paying attention to each individual's broader needs. All of that overarches a well coordinated, high quality, accessible system. Together, all of these principles become a practical checklist for every decision that communities have to make as they continue working to strengthen the system. So when you're making decisions about policies, about funding, about partnerships, about workforce, or how to deliver services, you can always come back to these principles and ask those questions. Are we truly coordinating our system? Are we keeping people and families at the center of our system? Are we making care accessible, safe? Are we supporting recovery and continuity of care? And are we continuously improving the way that the system functions? If the answer to those questions is yes, then you're moving closer to the vision that we've been discussing throughout today's presentation. So these principles describe what that coordinated system should look like. And then the next slide, we're going to focus on the infrastructure that will make it all possible. Next slide, please. A community can have someone to contact, someone to respond, in a safe place for help, but without infrastructure, those services won't function as a coordinated system. The national guidelines identifies 7 infrastructure components. First, administrative structure, oversight, and policy. This is where governance and the accountable entity provide leadership, coordinate partners, and support continuous improvement. Next, communications and community engagement. Communities need clear information about how to access care, and people with lived experience should help shape the system. Third, responsive behavioral health crisis care. Services should be accessible to all communities and responsive, culturally responsive as well, across populations and across the lifespan. Fourth, you look at evaluation and data. Data helps us understand not only how many people were served, but whether the system is working and whether those people were served well, and where can the system do a better job. Fifth, technology. And technology is key because technology supports our communication. It supports timely referrals. Supports dispatch of mobile crisis, data sharing and coordination. I remember I said earlier, a person moving from one service to another, if they have to tell their story over and over and over, that can be really discouraging. But technology, it's right there and gives us a way to kind of move that story along with the person without them having to relive the crisis over and over again. So technology can help us in so many ways, including the emerging field of AI. And we have to look at use of AI in very ethical ways, but it is a tool that can help us to coordinate our system and sustain it. Sixth, financing and fiscal sustainability. Can't do any of this without funding. Sustainable funding is essential to maintaining services, building that infrastructure, and funding is important to increase quality over time. And finally, workforce. None of this happens without the dedicated people who answer the calls, who respond in the community, who provide the crisis stabilization services, who help to coordinate care, and the people who lead the systems. So these aren't 7 separate components. The infrastructure works together to support the coordinated system. So to come back again to our Lego analogy one last time, these aren't the visible bricks, the infrastructure pieces. They're the framework that holds the entire build together. Like with the Legos, all Lego sets come with this wonderful instruction book. And in Lego, they give you pictures and words to help you. So this is the infrastructure that will help me take the pieces and build them. So it supports my work. So now that we've looked at the vision, the principles, and the infrastructure, let's come back to those reflection questions because I'd love to begin hearing from you. So we covered a lot of information over the last several minutes. And again, let's begin to shift into more of a discussion. So I introduced these 5 reflection questions earlier from the national guidelines, and I asked you to keep them in mind as we looked more at the vision, the principles, and the infrastructure. So now it's your turn to apply that framework in your mind to your own community. We're going to use a few Zoom polls, and we're going to use a Mentimeter exercise to help us do that. And as we go through, there are no right, no wrong answers. Every community is at a different stage, and the goal isn't to compare communities. It's to help you begin to think about your own strengths and your own opportunities for growth. So let's start with a real broad question. Thinking about next slide, please. Thinking about everything we've discussed so far, which stage best describes your community's journey toward a behavioral health coordinated system of care? And if someone would put the poll up for us. So thinking about your community as a whole, not just your own organization, which of these stages best describes where you are today? So take a few moments, read the options, and submit your responses. Give it just a few more moments. Yeah, are we ready to take a look at the results? Okay, good to see. We've got a lot of people who are, I think the majority of the folks who are with us today are in that building stage. You have some services in place and you're actively working to fill gaps. And we have another large segment who are working now to connect. You have the services across all the elements, and then you're working on that key coordination and integration and infrastructure. And yay for the peer agencies in the room who are in the sustainability and quality improvement stage, because you guys kind of are the North Star for everybody, so to speak. And we're looking at you for those key lessons learned, and hopefully in the future we'll be able to bring some of you onto a webinar so that we can talk to you about how you work through these stages. And yay for those groups who are in the early awareness and the early planning stages, because again, as I said, we're at different stages all across the country. But what I see is that everybody is working some way, and that is very encouraging for me. So let's move on. So you've identified where your community is. Let's take a look at what might help you to move forward. So our second question, what is the most urgent gap in your crisis system right now? And you'll be able to select all that apply here. And this isn't just a question about adding services. It's really a question about strengthening your system, which is, why we want to look at where these gaps exist. So I'll give you a couple of minutes, or minute, a couple of seconds, up to a minute, because I'm mindful of our time to select your answer there. 'Cause I'm always interested to see how communities answer this question, because it tells us where people see, their greatest opportunities for growth. Are we ready to look at our results? Okay. So again, I'm encouraged. Everybody has something, whether it's you got your 988 and you're working for your contact center to, have your answer rates up and the quality of your calls. That's great. We all have to start somewhere. And then I see it. This is kind of exactly how I thought it would look. You see that gradual progression from where the where the gaps are, and it's kind of what we expected and why we developed the guidance, because everybody's got the 988. Some people have added the mobile crisis. Some people have added the crisis stabilization. Some people are doing the connection, but we definitely see that there's more work that has to be done, because the majority of us said the biggest gap is what we're talking about today, that connection piece. But we all have something, and that is always encouraging, and it gives us here at SAMHSA and at the TTAC, it kind of gives us a challenge. So it's really good to see that. So we've heard what your community needs. Now I'd like to hear from you, maybe in your own words, not just a poll, about what's working, what's challenging, and what lessons you've learned along the way. So we're going to do 2 Mentimeter prompts. The first, what are the barriers to developing a comprehensive behavioral health coordinated system of crisis care? And Conchal, you're going to help us with the Mentimeter?
Coming up,
Conchal, do you want to give everybody instructions on how to access the question?
yeah, sure. So either Scan the QR code that you see on the right side of the slide, and it will take you to the Mentimeter question where you can put your responses, or go to menti.com on your browser, put in that code that you'll see on top of your screen, and it'll direct you to the same question area where you can input your questions, uh, input your answers for the question you see on your screen.
So I'm seeing a lot of funding as a barrier. That seems to be the overwhelming consensus that funding is a barrier and fragmented connections between services, in addition to funding, a lack of other resources, workforce shortages. So these are a lot of the barriers that I anticipated. And it kind of brings home again the importance of that accountable entity in helping systems to identify the key barriers in the system and work together to come up with solutions for those. It's hard to do those when you have isolated, say, pockets of funding. Systems that are able to come together and figure out how to braid funding, how to blend funding, how to say work in partnership to apply for grants. A lot of grants would be better if groups decided that we'll apply together rather than everybody trying to apply individually. We love to see a good partnership here at SAMHSA. So thank you for sharing those barriers. Those are important, and we're going to capture all of those. And again, I'm going to talk in a few minutes when we get closer to the end about what we're going to use this information to do. So let's move to the next prompt. We're going to look at the other side of the equation. What are the assets and strengths that are being leveraged to achieve this vision of a coordinated system? What could be better leveraged in your communities? And we'll give you a few seconds to type in your responses there. And every community has strengths. All right. So I see that a lot of you are working toward developing those partnerships and steering committees. Um, your state government is seen as a strength, and a lot of times that is the accountable entity, is the state government. Philanthropic funding. So some people are finding solutions to funding. And we may do a webinar on accessing philanthropic funding because I think for a lot of communities that is an untapped resource. People with lived experience. I want to jump up and down that everybody or someone recognize that that is a key strength in the system is talking to the people who have experienced or our crisis services because they can let you know if your system is doing well or if your system is not. Their personal experience of, we may look at the system and think, yes, it's set up right, it's got to work. But those who've been through it are the ones who can really let you know if what you thought you saw was actually what was behind the pretty picture. All right. So again, we'll capture all of those. Applause to that 90% answer rate. It's important that when people call, there's somebody there to answer. So I really appreciate all of these strengths that you all have shared. Both the barriers and the strengths are important, and those two perspectives, they have to go together. So you have to understand the barriers because that helps you to identify where support is needed, all at the same time recognizing what assets exist in your communities and helping you to build from a position of strength. So for our final poll, I'd like you to turn that reflection into a practical look ahead. Think about over the next year, where would targeted support be the most useful to your system? What do you need the most help with over the next year? I'll give you a couple of seconds to answer. Are we ready to look at our results? Okay, a really good mix from administrative to communications, responsive care, evaluation and data, technology, financing, behavioral health, workforce recruitment, a really good mix of things. And none of these are we don't see them as competing priorities. They're complementary investments or opportunities for investment within the same system. And your responses help to inform the future work of not only this work stream, but the work of the TTAC overall. So next slide. Let me briefly show you how your responses will inform the upcoming TTAC resources and the types of support that we're planning for the year ahead. So again, thank you for all of your input today. I really appreciate your willingness to share where your communities are, what's working well, and where you see the opportunities, because it helps us to see that from that same lens. And one of the reasons we ask these questions is because your feedback, it doesn't just stay in a vacuum. It's not going to just stay in the chat here in the webinar today. It's going to help us inform the work we're doing through the TTAC and specifically work on the national guidelines and the model definitions and how to make that come alive so communities can actually see themselves within the documents and see a path forward. As you've noticed through our discussion today, again, communities, we're at all different places, but we have a lot of the same questions. You know, how do we strengthen governance? How do we improve coordination? How do we sustain? How do we increase the workforce? We all have the same questions, even though we're in different places. And our goal is to help you to develop those resources that will help to answer those questions. So over the coming year, you'll see several types of new resources coming from us. You'll have, you know, our trusty handy dandy webinars because it's an opportunity for us to deliver information in a very efficient way, but also an opportunity to talk to you as well. But we're also going to start doing some interview style videos in a series featuring some of you, state and local system leaders. And one of the things we've learned is that communities value hearing directly from their peers. You like hearing from each other, and we like hearing from you. So we're going to do some interviews with those of you at every stage along the continuum because it's important for us to hear what newer systems are working on and have accomplished. And again, those systems that are well developed, some sharing of lessons learned will be important. So we're going to do that in a new, interesting way. And then, of course, we're going to be working on developing some new supplemental guidelines based on your feedback. We've got again, the mobile crisis and the crisis stabilization guidelines that will be coming out very, very shortly. But we also recognize that we can't stop there, that there's so many other topics that we're in a position to provide some really significant guidance for. So we're committed to do that. So if we'll go to the next slide, I think this is bringing us to the end of my part of the presentation. So I'd like to close again by thanking you for all the work that you're doing every day. We see what you're doing. We highlight what you're doing. When we give briefings, we don't give briefings about us. We give briefings about you and what you're doing because you are an important piece of this bag of Legos. It's not just the services, it's the people that deliver the services and the people who lead the services. So thank you for joining us today, and I'd be happy to answer any questions you may have. So I'll turn it back over to Samitra for our Q&A.